Hey everyone, my name is Leo Meller. I'm a second year medical student at UC San Diego, and today I'm excited to present my first poster of the day, which is a case report titled Uveitis, Retinal Vasculitis, and Autoimmune Retinopathy in the setting of Necrobiotic Xanthogranuloma, aka NXG. I'm Leo. I'm the first presenting author today, but the co-authors are Andrew Lin, who's a resident at ACSD, Tim, my classmates, and Dr. Spencer, the PI on this project. So brief introduction into what NXG is. So NXG is a rare multi-system chronic non-Langerhans histocystic granuloma disease. It is very rare, and however, typically in the setting of ophthalmology, it's typically described in the periorbital region, and but very rarely do report actual ocular involvement, like in this case, uveitis. So presently, we report the first reported case of NXG associated with uveitis, retinal vasculitis, and presumed autoimmune retinopathy. So case description. The patient was a pleasant 58-year-old female with a history of monoclonal gammopathy, initially presenting with uveitis in the right eye, and she was treated at first with topical steroids. However, she began to experience bilateral vision loss and eye pain and progressive dyschromatopsia and development of a left afferent pupillary defect. During the workup, we did a biopsy of her eye because there was a mass that was growing, and that proved it was an NXG presenting as a left orbital mass. So we ran an electroretinogram that showed diffuse cone rod dysfunction as well as electronegative B wave. Ultimately, we used fluorescein angiography, which is the gold standard for diagnosing retinal vasculitis, and it showed diffuse retinal vasculitis, and she was treated with rituximab. Afterwards, our current treatment method, so this is an ongoing case, and her current treatment methods includes intravenous immunoglobulin, and because we're worried about her potential way to develop autoimmune retinopathy, and she was ultimately referred to radiation oncology for radiotherapy for potential optic nerve compression due to the NXG. And here are two imaging showing the retinal vasculitis in this case. So the overall goal of this reported case is to really report that NXG could be potentially associated with uveitis. So currently, there are many different causes of uveitis, typically systemic to the very different systemic diseases, but that really do report on NXG, especially the effects of NXG in the ocular involvement. So the goal of this case is to report the first reported case of uveitis, retinal vasculitis, and presumed autoimmune retinopathy in association with orbital and systemic NXG, which is a rare granulomatous disease. We'll highlight the ophthalmic manifestation of NXG and develop the importance of a very collaborative approach. As you can see that we are also collaborating with radiation oncology because the NXG could be compressing on the optic nerves. And that's the end of my presentation.
All righty, thanks, Leo. We do have a submitted question here. I'm going to read it off. So it says, was the monoclonal gammopathy a factor in the development of any of her conditions?
Yes, so I mean that's what we believe right now, because typically, sure, so uveitis could be caused by infection, could be iatrogenious, but in this case, the only reasonable cause for her would be the NXG causing inflammation in her eye and contributing to the uveitis, and that's what me and the attending thought it was.